Hello, I am Dr. ANAMIKA, Gynae and Fertility Consultant from MIDAS Clinic. Today we will be starting with our video series on menstruation. We will be talking about each and every issue the patient faces during menstruation. In the first video we are going to talk about the first cycle of your daughter. That is the first menstrual cycle any female gets in her life. In scientific language we call it menarche. So the questions which can arise in your mind are how this occurs and when you should talk to your daughter about this, why it is getting earlier in our girls nowadays, and how early it is still too early and we need to intervene. Is the early menarche or early first cycle going to affect the adult height of the child, and what as a parents you can do to avoid early menarche in your kids. So let's start. How menarche occurs? Menarche is nothing but the first menstrual cycle. At a specific age, there are certain hormonal signals which starts from the brain, comes to the ovaries, and there is release of hormones to prepare the uterus for future pregnancy. You can compare this to a circus of hormones in which the ringmaster lies in the brain, hypothalamus and pituitary, and they are trying to train the ovaries to conduct a task. And what is the task? The task is to make the uterus ready for a future pregnancy, and when this doesn't happen, the lining of the uterus is shed with blood and that comes out like menstrual blood, and again the next cycle starts. When we should start talking to our daughters about menarche or menstrual cycles? To the relief of every parent, this menarche doesn't happen as an abrupt thing in her life. The child will first have thalarche, that is breast budding or development of breast. Then comes pubic hair and axillary hair, and then menses. So when you notice the first sign of breast development or hairs on her body, this is the right time for you to talk to your daughter and make her aware of the physical changes which she is going to have in the coming years. Now as we are seeing that the girls in this generation are getting their cycles earlier. So why the girls are getting their cycle earlier? This is a multifactorial thing. It has environmental factors and many other social factors too, like rising temperature, more of screen time to the kids, more rise in childhood obesity, the use of more of animal fat in food, and use of plastic, many kinds of pollutions, preservatives, etc. Okay, now how early? It is still too early that we need to intervene. When we notice breast development below the age of 8, this is the time we need to see the doctor to see that the child is not suffering from any hormonal disorder. So here it is very important to point out that breast development is not just a pad of fat. Many a times in this generation we see that childhood obesity is rising, and even the girls of 4 year, 5 year, 6 year are showing a pad of fat at the chest. So you have to differentiate between that chest pad of fat and breast development. Breast development on palpation will feel a bit ductular and not like only fat. And when you notice that the child is really having breast budding at an earlier age than 8, please see the doctor so that the doctor can help you in the right time. Now the next thing which comes to a parent's mind is this early menarche going to affect the height of my child? Here we need to understand that the height of a person which she or he is going to gain is also dependent on many things, and most importantly it depends on the height of parents. Genetic issues play a very great role in this thing, and there are other factors also like nutritional factor and she is suffering from any infection or not. So don't get worried that the child has got her menarche in an early age so she will not gain the height. You have to do only one thing. take care of the nutrition, and prevent any kind of infection and injury at this stage of life. If the child has attained menarche earlier, she will attain the growth spurt earlier too, but the growth will not stop or not be dampened by all this. Now, what as parents you can do to keep your child safe from early menarche? So the answer lies in the word safe itself. S stands for sleep. Take care that the child is having proper good quality sleep of 8 to 9 hours, and she is not having any screen time just before going to bed. When the child is sleep deprived, the brain takes it like hunger. The signals are same as hunger, and so it leads to binge eating and obesity. Second thing, avoid cosmetics, avoid any kind of exposure to adult contents, avoid too much of screen time. F stands for food habit. Food habit is going to play a great role in her health in the coming years. So give her homemade food, give her food which is nutritious, high in fiber. Cook her food in stainless steel, not in plastic containers. Do not use more of microwave. Do not serve her food in plastic plates, because these things will add chemicals to her body like BPA and phthalate, and this will lead to early menarche. And try to change her tiffin boxes from plastic to stainless steel. Give her water in steel bottle. Uh, Take care that she is not taking too much of packed food, outside food, and take care of the sugar content in the food which she is taking from outside. Many a times it's written that it's sugar free, but there are many hidden sugar in that. Take care that she is not getting too much of cola and ketchups, chocolates. These things have adverse effect on the child's health, and they will lead to early menarche in the kid. And the last word, E, stands for exercise. The child of her age will need exercise of at least 60 minutes a day. In today's scenario, when the kids are not going out, it's getting difficult, but you can help here. But still we can help them by giving her activities which can be done in her own premises, like cycling, skipping, and you can also join her in playing badminton. These things can be done in intervals. It's not necessary that she is doing a activity continuously for 60 minutes. You can have a 20-minute 3 episodes of exercises in a day, so that her body is getting the stretching which is needed in these years, and she is not getting obese.